2020 has been a year of a lot of misery and suffering for the entire world. We were hit by the COVID-19 pandemic that threw economies of the entire world out of order. India was also one of them. The expectations from this year's budget essentially are in the sector of healthcare, because healthcare is a primary focus sector. From the perspective of the vaccination of the public at large, there's an expectation that the government would spend monies towards vaccinating a majority of the public, if not all. The second expectation was that the government would allow funds for development and further development of the healthcare infrastructure, which means hospitals, diagnostic centers, primary, secondary and tertiary healthcare centers. The third was more from an industry perspective, where the industry, which is also fighting the ravages of this pandemic, was hoping that the government would give certain incentives to the sector to produce in India, to come out of the ravages of this pandemic. And then also the public at large had certain expectations from the budget, in that there would be a reduction in the overall cost of healthcare. There would be an increase in the quality of healthcare. So these were essentially the 4 or 5 major expectations. Now, the budget has been presented, and I think out of these, primarily, it's very clear that the budget is a healthcare focused budget. A 2.24 lakh crore outlay, which is about 137% increase over last year, is a phenomenal expression of the fact that the government is focusing on the healthcare sector. Primarily, the vaccination, the COVID-19 vaccination drive, the government has outlaid funds of about 35,000 crores for this. This, I feel, would be somewhat enough to vaccinate at least up till the second phase, if not more. And that said, the finance minister has said that she has promised more funds. So obviously there is a focus towards providing vaccination to the public at large. I think on the development of the infrastructure front, there is almost a 65,000 crore outlay towards developing primary, secondary, tertiary healthcare facilities. There is a proposal towards developing level 3 R&D labs, which is extremely important. There's a proposal towards further supporting the National Center for Disease Control. That is also there. The focus of this budget is essentially in terms of re-looking at the healthcare system of the country and developing it, because COVID-19 really exposed the fault lines in our healthcare system. We are hopeful that these budgetary allocations are going to go a long way. As far as other expectations, like patient expectations of reduction in healthcare costs, while the budget is silent on them, but I would say that those concerns can be taken care of by other existing legislations which do allow for price controls. I think as far as industry expectations, I feel that the industry may not be very happy, because a lot of those expectations have not been met. There are no concessions on imports, there are no reductions in any import duties. But at the same time, there are no additional taxes that have been imposed. So I think overall it's a balanced sort of situation. But I think at the end of it all, the fact of the matter is our healthcare sector needed a push, and this budget provides for that very, very important push. I would say that they have treated the healthcare sector like a defense, like the defense sector, and given it equal sort of focus of the government. And now I think the proof is going to be in the pudding, in how these funds are utilized and how our healthcare infrastructure is developed.